We have to remember that healthcare is a team sport. That's number one. Whatever we do in healthcare is not an individual effort, it's always a team. Our ability to do our jobs and to do it well, not just well, but really at the cutting edge of where we need to be, can be significantly enhanced by the community and the contributions they can make for it.
As a donor, you might not understand that
what difference it could make.
What the difference it can make in a patient's life. If you can make that difference, large or small, it goes to good use here.
The 4D scanner system, we're revolutionizing our ability to do stroke imaging and treatment within the same system that we're building. We're working on a high-frequency ultrasound that will allow us to liquefy brain tumors without ever opening up the head and doing cranial surgery.
We had only one robot in 2010-11. We were able to acquire another system, I think in 2015, and then every couple of years another system, to now becoming the 5 robotic system hospital we are, which is the biggest robotics program in the area. Having a multi-specialty robotic surgery program is truly amazing. It's rare, it's unique, and it is so beneficial for our patients. They're always improving. Every model, every version, I think, shows a different aspect of technology that makes the surgeon's life better.
If you need to access the facility, you're investing in your own future. If you have a friend or relative that needs care, it's an investment to help them. And you need to have the investment because of the pace of change in the technology, the educational process, all of that's involved to keep the level of care at the highest possible point it could possibly be.
It's not just, okay, here's some money. You're changing lives. You change the outlook on how this looks for us. It's nice for your child to be able to focus on being a child, to be able to heal and not be defined by the disease that they have or the circumstances that they're facing at that time. You touch lives beyond measure and you don't even know it.
Whether they're there for an emergency room visit, whether they are in the NICU, or they end up spending 151 days like Logan did. Without any of that help or any of those donations, Logan wouldn't be thriving where he is today.
What if we didn't live in a city that had a hospital such as this, that had the equipment that could save his life? Literally, without that machine, I wouldn't have my son.
We're just grateful to have more time with her and to see her do so well, because we didn't think she would be the way she is today.
For patients like Tasha, she spent a long time in our ICU, and her condition is exactly where we would want to use the air tap. She had a condition where she couldn't move. It was a neurologic condition where her body was essentially paralyzed, and we had to move her a lot.
And so before the air tap, you'd have to recruit a bunch of people to come in and help you, taking resources away from other rooms. It looks like a pool float. It's wonderful. It inflates like a pool float. It fills with air, and it will levitate the patient up off of the surface of the mattress so that you can easily move them around the bed, boost them up.
They see the results of their donation, which they see at the bedside. The more engaged they are, the more they are committed to our success. The more our organization is successful, then that serves our mission of high-value care for the patient, serving the health of the community, but also the health of our staff.
Without the help of philanthropy, we wouldn't have those psychology supports here in the hospital. Until we're in a situation where insurance is willing and able to reimburse for all the needs that we have, we really do need the philanthropic support in order to address the needs of all the children and all the families.
From the nurses to the people that came in and emptied the waste paper baskets in the morning, the people that was in transport taking me down for scans and MRIs, and believe me, I had a ton of those. It was just everybody. They were all special.
Our small contribution might dramatically change an entire course of care for a family or an individual. Thank you to everyone that does. It impacts an innumerable number of lives in our community, and it's an incredible way for us to give back.